तो इतनी मजबूत है, इधर first patient who came was a bonus for her, then Anita. Not first, I saw her first, Anita came after her. When she went out, Anita came. And after 10 minutes, I called her. वो अनीता जो थी, जो मैं बुलाया था तुमको अंदर दिखाने को पेशेंट, वो पेशेंट ने तुमको क्या बोला? क्या बोला तुमको? कितने अच्छा हुई, कितनी ये दवाई से कितनी अच्छी हुई? क्या बोला तुम्हारे सामने बोला ना, कितनी अच्छी हुई? See, she was hesitating to take treatment. Rheumatoid arthritis. It's 1 second diagnosis. According to me, 1 second, 1 minute diagnosis. It's all rubbish that people are making it so complicated. In the textbooks, you're writing deviation and this and deformities and all that nonsense because this is more common abroad. You don't compare to abroad. If you're in London, you have rheumatoid arthritis, means maroon gela. Maroon gela. You're one case. One case, why? Because you are a GP. And you first of all, GPs there also, their thinking is all above and all. You would first 3-4 weeks, so you're not thinking. By the time you think, you don't have already consultant opinion. So you go and take ring of appointment. Yes, yeah, 20th August she can come at 2 p.m. 20th August, June, July and all is finished. What you can treat rheumatoid arthritis? Here I am talking opposite. I am teaching rheumatoid arthritis is a medical emergency. Don't wait for one day. Start doing it. The moment you start, you see this, when she went out, she was not very happy. She was diagnosed rheumatoid arthritis. So when I told her, you'll have to take methotrexate, maybe for 5 years, maybe for 10 years, maybe longer, maybe 15 years. She was not very happy. I explained to her. I said, you have suffered so much. By the time this lady entered, Anita, so I called her back. Yeah, Anita said, Pucho, I said. Anita, who has not come today, I showed her the file. She was 2 years, she was going around so-called rheumatologists. When I say so-called rheumatologist, means if somebody can ask for rheumatoid factor and he can show this is an IgG antibodies against so and so, so and so, becomes a rheumatologist. So doing all this testing. When I saw her, Anita, about वो जो को आपने देखा था ना, वो पहली बार नहीं आई थी मेरे पास, वो शायद दूसरी में आई थी. By the time yesterday she came, second, third time. So I diagnosed that she had joint pains, but which joints? Same. It's the first interphalangeal joint, metacarpophalangeal joint, wrist joint. And if you, it's always on both sides, never in one hand. But the impression in the students that they learn or doctors is that is bilateral, symmetrical, that there you go wrong. There you go wrong. Bilateral, yes, it has to be bilateral. Because unilateral need swelling or dis-swelling of one joint. Unilateral. 6 months. How do you know it's not tuberculosis of the joint? That's the commonest cause. So bilateral is the important thing. That there should be something there, something here. They're not happy. It's not tuberculosis. If there is not that infection, what else? Autoimmune infection. It is autoimmune infection. So that Anita had pain in these 2-3, these joints, I don't remember, 2-3 year wrist. No. Number 2, early morning sickness. That day I showed you ankylosing spondylitis and I talked about it. Anita used to get up in the morning, she would make tea, husband had to make tea. She was sick for 1 hour, 1 hour, husband had to come and give her tea. Then she get up, then of course, by then she goes to bath, comes out, she was better. And when I pressed this joint, it was painful. Every time it goes. Last time also, very good, very good. Good of it. When I pressed the joint, it was tender. To tenderness means Kamlesh. उसको बोलो इंसिडेंट नहीं किया था, ये check very short. It was tender. So tenderness, pain, early morning stiffness, finish. Or going on for a long time, so not improving. I explained to her, this is rheumatoid arthritis. Her rheumatoid factor was negative in order. Okay? I didn't want to see it. But I told my boy to collect that blood for NTCCP, just like that. So I wanted to make sure what is the position of this thing. But I said, you got rheumatoid arthritis. So I said, I'll start DMRD drugs. Methotrexate is the most important drug. Weekly dose of 7.5 milligrams. And as a general practitioner and physician, don't increase it to more than say 10. According to me, 10. I hardly use 10. You'll be surprised. 7.5 is an average dose. Sometimes I make it 10 in some patients who don't respond. But you can give up to 20, 25. But moment patient needs more than that, pass on to a rheumatologist. It will not be common, it's less common, because then side effects of pulmonary fibrosis, etc., then increase, or the liver side effects on the liver and blood test count, etc. So I put it on that, and I will show you after the interval how put on combination of methotrexate, hydroxychloroquine, 1 tablet, and then salazopyrin, 1 milligram per day, with folic acid. Methotrexate, folic acid. Folic acid has to be given with this drug. Third, leflunomide, 20 milligram 5 times a day for 3 days. First 3 days, 100. Then 1 tablet of leflunomide. And I told her, these 4 medicines you are going to take for a few years. This will start working after 6 to 8 weeks. And now I am giving you one more. So prednisone, ridone, prednisone, 20 milligram per day for 3 weeks, 10 milligram for another 3 weeks, 6 weeks. And I said, see, you will be alright within 8-10 days. When she came next time, she talked what I wrote down and she heard it. She told her that 3 दिन में 75% अच्छी हो गई मैं, वो तुमको ये बता रही थी अनिता, 3 दिन में 75% अच्छी हो गई और 6 हफ्ते में 100% अच्छी हो गई बोलती. This was due to the effect of what? Prednisone, initial. 6 weeks was the effect of DMRD. Methotrexate, hydrochloroquine, leflunomide, combination of these. And since then she didn't have pain. She was maintaining this dose. So she was telling her, अरे ले दवाई ले बहुत अच्छी. And this poor lady has been having for last 1 year. Oh, beautiful. ये तो बहुत होशियार है. Very intelligent. This brain. She used to conduct embroidery classes. Embroidery is very difficult. All your wives and all know nothing about embroidery. Zero. Nobody knows. Olden days, many women knew. My wife knows it. Embroidery. But she used to teach embroidery. See, embroidery work is very difficult. And she used to get up in the morning and 4 बजे उठ के नमाज पढ़ती थी, 5 बजे घर का काम करती थी, सुबह 7 बजे 15 स्टूडेंट्स आते थे और ये एम्ब्रॉयडरी सिखाती थी. हाँ या ना बोल हाँ या ना बोलते जाओ. हाँ, और रात को 8 बजे तक 9 बजे तक एम्ब्रॉयडरी सिखाती थी. हाँ या ना. हाँ. Now, such a woman, if she tells you that अभी सुबह उठती है, उठा ही नहीं जाता. She is stiff for 1 to 2 hours. She can't get up. She can't embroidery classes. Khalas. Arabic people do like this. Khalas. She's gone. She's lost her business. She's not earning. Husband is not earning enough. 1 year has passed. Chikungunya test was positive. Chikungunya irritates me like that. This chikungunya test. Agree. That Ramdev doesn't know this. Ramdev says you do this, you do this and you become on. But Ramdev doesn't know that we have water problem. We have mosquito problem. Mosquito causes malaria, mosquito causes dengue, mosquito is causing now chikungunya. Not all over the world, only in India. He has come down to India. Now there is a blood test. Will you rely on these people when universally there is no blood test? Will you? After all, it's an ELISA test. Somebody has started manufacturing. How much have you done work on it? I want to know that. How many positive? How many negative? How many controls? It's a useless thing. Chikungunya fever I will diagnose in a patient who gets an acute onset of fever, arthritis, maybe in the morning, joint pain, rash. And most of them become alright within 2 or 4 weeks. There are some who can continue. I am not saying that. Mind you, I have that suspicion in my mind always. Am I missing chikungunya chronic? It is not common, not very common. And these people are supposed to have pain in the spine. Initially they thought the chikungunya is like a chicken, that you walk like a chicken because of the spinal pain. I am not saying spinal pain. Nothing, they have arthritis and disappear. Her test was done in some user's laboratory. She was diagnosed as chikungunya. But when I saw her, कौन से संदेह तुम्हारे घुटने दिखाओ इधर ये इधर के इधर ये wrist is very important wrist involvement. And you will see actually if you feel the wrist, she is 1 year old disease, her wrist is thicker than mine. See, it's a synovium which is thicker. This is synovitis is the inflammation which I am trying to treat. And her wrist is thick. And all this rheumatoid arthritis, this is less, this is ye does that. Her left wrist, right wrist is less. It's an asymmetric, it's not symmetrical. Asymmetrical but bilateral. Now, this is the only, and I have, fortunately, the lady who brought her happened to be her sister. I didn't know. She said, I'm treating her for rheumatoid arthritis. Rheumatoid arthritis runs the family. I said, my God, your sister has got, and you also have got the same. So, she went on telling her sister, कोई डॉक्टर कोई बड़ी दवाई लिख के देगा तो मैं नहीं लूंगी, लंबे के लिए लिख के देगा मैं नहीं लूंगी. She already told her. So I told her. God was kind to me. Anita came after her. I called her, and Anita was not come. Anita offered herself. She said, I'll come in on the stage. I'll show you. She didn't come. According to me, she's a very high class family with the amount of diamonds and gold which she was wearing. My God. I mean, mind boggling, you can't see. And she must be really busy something. But she told her, मैं 3 दिन में 75% अच्छी हो गई थी, 6 हफ्ते में 100% अच्छी हो गई थी, अब तक दवाइयाँ ले रही हूँ. She is now 1.5 years. And her anti-CCP electron came positive. Anita, rheumatoid factor, according to me, should be abolished. I'm very sorry to say that. It came initially, we used to do the other test, rose water test, that became useless. Then we started doing rheumatoid, it's an IgG antibody, very poor specificity, sensitivity, specificity, very poor. Especially specificity. Sensitivity even is poor because it's negative in so many things. And not only that, anti-CCP came as a test, which is a very, very much better test. But unfortunately, in the early phases, it's often negative. We want the drug for early phases, where you give synovitis drugs so that they don't develop the contractures and all. She is going to do embroidery. I will never like her fingers to be even slightly deviated like this. How will she do embroidery? I don't understand. And according to me, it's a clinical diagnosis. At the most, we do ESR. Her ESR was done, it was 70. In my we started being out about this technician, he doesn't send the blood out. He doesn't believe because we're getting all funny reports. It's a simple test. Puts it. And I put her on the same treatment which I told you, तुम दवाई लेगी, promise करती, सबके सामने, फिर तुम मेरे हिसाब से 3 महीने के अंदर तुम्हारी एम्ब्रॉयडरी क्लासेस में शुरू हुई. And there is no test, no bone scale, no X-rays, no MRI, clinical diagnosis. Give her a big hand.